right, well, congratulations to all of you for still being here. And I hope all of you win the raffle. So what we're going to do is I'm going to talk about the emotional challenges of a fat disorder. You've heard that. I mean, you heard that from Joanna Dudek. You heard it from Dr. Bartholomew. My background is I'm a psychologist. For 30 years, over 30 years, I worked in a medical center, and now I'm in private practice and specialize in stress, anxiety, panic, phobias, and dealing with chronic illness, and frequently speak to healthcare professionals and lay groups. I am an author of books related to lymphedema and to some extent to lipedema. I wrote the Overcoming the Emotional Challenges of Lymphedema, co-author of Voices of Lymphedema, and co-author of Living Well with Lymphedema, Lymphedema Caregiver's Guide, and the Lymphedema and Lipedema Nutrition Guide. So my financial disclosures are that I get book royalties, and ignore the honoraria. That was from another talk. So I'm going to talk about just 4 common emotional challenges. The first is anger. You know, anger at the universe, why me? Anger at your doctor for not understanding. Anger at other people for not knowing, for not understanding. Second is just sadness, self-pity, this sense of being overwhelmed. You know, helplessness. This is too hard. I give up. Third is self-consciousness and embarrassment, like other people are looking at my slide and judging that I didn't get the spacing right. And shame and self-blame. You know, I knew I should have looked at those slides better. It's all my fault. You know, those negative thoughts out there are true. That negative bias is true about me. Just taking all the negative, not fighting it, not challenging it, not balancing it out. So there are a lot of factors that contribute to this, right? I mean, you know, you've heard them throughout the conference. The lack of knowledge about fat disorders, and in the absence of knowledge, what do we fall back on? We fall back on common beliefs, we fall back on bias and prejudice. And we all know the common beliefs and prejudices about being overweight or having some kind of fat problem, right? Dr. Bartholomew just went through them. And you know, what did you know about fat disorders before your diagnosis, right? I mean, if our MDs don't know about it, how much do our neighbors, our spouses, our co-workers, our bosses, right? And we talked about weight bias. I mean, society criticizes and makes fun of people who have a fat problem, who have a weight problem. You look at the media, right? Look at the villains. I'm thinking Ursula the Sea Witch, right, in Disney's Ariel, right? Thank you. Yes, Little Mermaid. She got a very sexy song, but she is not given a sexy body. There's just all of these misconceptions, these preconceptions about what a weight problem means. And all of this induces stress, and stress then starts this whole negative cycle, right? Stress increases abdominal fat. Abdominal fat acts hormonally to increase stress hormones. You know, external stresses reduce stress hormones. So you've heard some of the recommendations that have been made by Dr. Francomano, I think I've just mispronounced your name, by Joanna Dudek, things like mindfulness, things like relaxation, things like exercise, finding ways to reduce stress. And one definition of stress is that the perceived challenge outweighs your resources and your ability to respond, to cope, okay? So my purpose in this talk is to give you tools and tips and techniques so that you leave here feeling more empowered. Because you're still going to be dealing with those stresses, physical and societal and emotional. But if you have the resources, then they don't impact you the same way. They don't impact you the same way emotionally, and they don't impact you the same way physiologically. They've done studies of cortisol, one of the main stress hormones. They've measured blood cortisol levels in soldiers who are about to do something very physically challenging and demanding. And there was a subset of soldiers whose cortisol levels did not rise. Did not rise. And when they interviewed them, they found that what was different was that subset said to themselves, I can do this. I've trained for this. I've got the tools. I've got this down. I can do it. So it was the same challenge, but their belief was, I know what to do. I can handle this. And so it wasn't stressful. It wasn't stressful emotionally. It wasn't stressful physiologically. So let's talk about some tools to reduce each of these challenges. And I like to give talks that are almost collaborative and interactive. So I want you to think about right now one thing that you're feeling angry about or resentful about, or that tends to trigger anger, whether it's your doctor or your medical condition or your teenager or your neighbor or your boss or your coworker, okay? And the thing about anger is that psychologists talk about it as a secondary emotion. Let me talk about what I mean by that, by a secondary emotion. The best example is you're driving down the freeway, right? And maybe you're stressed already. And all of a sudden, somebody decides that they've got to cut right in front of you with about an inch because they've been in the far left lane and they've suddenly decided that they've got to get off right now. You know? And as they swerve in front of you and you almost hit them, right? They get off and you're thinking, right? And that's even assuming you keep both hands on the wheel and don't give them the little parting salute. But what happened right before the surge of anger? What were you feeling then? Fear, exactly. Anger is usually a response to some perceived threat, some sense of threat, some threat to your respect, threat to your self-esteem, threat to your health, threat to your future. So think about when you're angry. What's underneath that anger? What are you feeling threatened about? What are you feeling worried about? What are you concerned might happen? You know, what's really going on? And then also think about, what are you telling yourself about the other person that you're angry about? You know, did they really get up in the morning with the goal of pissing you off? You know, probably not. And if they are, find some way to stay away from them. You know, what's really going on? What are you telling yourself? Start to question it. Just because it feels righteous and empowering doesn't mean it's true. And certainly doesn't mean it's helpful. So really say, you know, do I really know that this is true? The assumptions, you know, what I'm telling myself about the other person's agenda, their meaning, their intent. Is your anger helping you or hurting you? You know, when I get angry at other drivers on the freeway, I think to myself, my anger just raises my blood pressure and just hurts me. It's just raising my stress hormones. I don't need that. I don't need that. As a matter of fact, I have started telling myself, be a Zen driver. and I tend to remind myself to just send out a Buddhist loving kindness meditation. You know, may they be safe, because I really don't want them to have another accident. May they be safe. May they be healthy. May they be happy. May they be made whole, and hopefully a whole lot better driver. You know, so think about what are the actual consequences of getting angry to you, to the other person, to the relationship, to this situation. What's really going on? Now, I'm not saying anger is bad, okay? Anger can be incredibly productive, and it's productive when it alerts you to a solvable problem and energizes you to do something about it. So get out there, write to your state senators, write to your representatives, you know, fight the insurance companies, you know, support new legislation, get the information you need. But the key is, you should be angry about a solvable problem and channel your anger into effective, productive action. Not churning, not spinning, not ruminating, not stewing. And when you can't change the external, when it's not solvable, You can't just say, I think I'll not have a fat disorder. Now, wouldn't that be nice? Yeah. So when it's not solvable, right, look at what you can change inside. Change your self-talk. How we talk to ourselves makes a huge difference. Makes a huge difference. If you say, this is overwhelming and I can't do it, you're going to feel overwhelmed and helpless. If you say, what do I need to do? This is really hard. I didn't want it. I don't like it. But by God, I'm going to do the best I can. Now, where can I find those tools and what information do I need? And let's roll up our sleeves and get down to work. You're going to feel better. Your body physiologically responds differently. You're going to cope differently, and you're starting a positive cycle. In most things in life, right, you have a choice, and you have a choice between a vicious cycle and what's called a virtuous cycle. So think about what are your expectations? Where are you putting your attention, on the problem or on possible solutions, things that could make it better? And one way to do this is to broaden your perspective. Ask yourself what I think of as the 3 ways question. So think about that situation that's making you kind of irritated right now. And first, sit down and write out or think about 3 ways it could be better. So start by getting the anger out. 3 ways you're really not happy with it. Things you wish were different that aren't happening, or things that you wish weren't happening that are. So start out with 3 ways it could be better. But then, having done that, broaden the perspective and write down 3 ways it actually could be much worse than it is. It opens up that perspective. And I want to tell you, I've got a wonderful daughter, and she's an ER nurse, and she's amazing, but you know, she went through adolescence. She was developmentally appropriate during her adolescence. and this tool really helped me. So what about sadness, self-pity, helplessness, right? One of those things is just kind of anchor yourself. You know, life just wasn't guaranteed to be fair. And the other thing I often find helpful is everybody has something. In fact, there's a wonderful phrase by Annie Lamott. Everyone has unseen wounds. Isn't that a wonderful phrase? You step back and you realize whatever's going on, they may be doing the best they can, and you don't know what their unseen wound is. So develop a philosophy or a religious view that supports you, and save your energy for constructive action and focus on what is possible. Now, there's a difference between sadness and depression, because you've heard Joanna Dudek's talk that depression is extremely common with lipedema, okay? Clinical depression is you're in a low mood most days, most of the time. You may find that you're pessimistic, you don't enjoy things that you would normally enjoy, your appetite goes up or down, that you have trouble sleeping or you're oversleeping, you have trouble concentrating, you're tired. Some of this can be physical effects of the lymphedema, of the diet, of the medications, of the condition. But if you have this entire cluster, right, don't just dismiss it. Consider the possibility that you've also got something going on biochemically with the neurotransmitters. Put things in perspective. So you take that broader view again, and this time you take the broader view not in terms of 3 ways could be better, could be worse, but take the broader perspective in the look, you know, back to the future, right? Looking back 5 years from now, 10 years from now, 20 years from now, what do I want to look back on in how I coped with this, in the choices I made, in the way I thought about it, in the way I treated myself and other people? You know, what kind of person do you want to be? What matters in the long run? What's going to give you a sense of satisfaction? So what about the self-consciousness, the embarrassment, all right? We know that people respond to our appearance. They do. That's a fact. The really encouraging research, though, is they also respond to your comfort level. There's something called emotional contagion. People pick up the emotions that we put out of the people around them. So the more comfortable you can feel with who you are, the more that is expressed to people. And there are certain ways that you can also hold yourself and interact with others that will help. You have your head up and you make eye contact. You smile. You nod. You send out to them a sense of, if you feel like, you work on feeling good about yourself, and you send that out to other people. They will respond to that. You have a kind of confident, relaxed, friendly posture, and a confident, friendly voice tone. You can influence other people. And engage in life. Don't avoid because you're not perfect. That just puts you in that negative spiral. Think about what gives you pleasure, what gives you meaning, what uses your talents and your skills. Make contact with people. You heard about the importance of social connection. Well, it's hard to make social connection if you're not out there with people. The internet only goes so far. You know? Think about the fact that you have the right to make your own choices. You have the right to feel good about yourself. If you're not going to be if you're not going to be standing up for yourself, who is? Right? And let go of what you don't control. And that includes other people's reactions. There's a wonderful phrase from AA. What other people think about me is none of my business. Isn't that a great phrase? You don't control it, and you kind of think, you know what? It's on them. My job is to take care of me. So take responsibility for what is absolutely under your control and let go of the rest. And really think about, what are you proud about? What are your talents? What are your skills? What do you like about yourself? What are your values? And partner with your body, because it's doing the best it can. You know, there's a phrase, your body is the precious physical plant that allows you to experience life. And I often think your body is kind of like a helpless baby, you know? It relies on you to take care of it. So, in what ways can you have gratitude for your body? Can you have admiration and respect that it's doing the best it can? That you can offer for your body loving care and compassion. And commit to a partnership with it. You are more than just your weight. You are more than just your fat disorder. Focus on what makes you the unique person you are. That's your view of yourself. You want to make that your story, your narrative. You want to live up to that. And I've got some rules for healthy self-talk and thinking. They've got to meet these two criteria. What you say has got to be objectively true, but if it is not helpful, I don't give it brain room. What you say to yourself needs to be true and helpful. If it's not helpful, why are you letting it in? Any more than you would put poison in your body. It needs to be realistic. It can't be, oh, everything's going to be fine, little Mary Sunshine, right? BS doesn't work. Got to be realistic, and it needs to be supportive. So this is where you're sort of talking about tough-minded support. This is where you get the perseverance. This is where you take care of yourself and you make a difference. Our emotions, have you ever noticed when you're in a great mood, you have happy thoughts, and when you're in a lousy mood, you have lousy thoughts, and physically that can affect it? I used to have to wake up really early, do a really long commute, work a very long day, and by about the third day, I got to tell you, I was in a bad mood. I was sleep deprived. I would be walking into work feeling self-pity and depressed, you know, and I knew it was temporary, and yeah, right. But so we have certain thoughts that come when we're feeling certain ways, but at the same time, How we're thinking, what we're telling ourselves, where we're directing our attention influences our emotions. So we can't just say, oh, I think I want to feel happy right now. But we can go and very deliberately change the focus of our attention. Notice what we're saying to ourselves and change it to healthier, more realistic, more supportive, more encouraging self-talk. And that creates a positive cycle. And that affects your mood, and your mood affects your coping, and all of that affects your body. And the bottom line is, don't believe everything you think. Just because you think it doesn't mean it's true or helpful. And if you're thinking things that make you feel bad or that interfere with your functioning, put them on the witness stand and just cross-examine the heck out of them. Just get in there and treat it like a hostile lying witness. Where's the evidence for that? Is that the only way to think about it? Is that 100% true? Is this what you would tell someone that you care about? If you were a wise mentor and someone was coming to you with these thoughts, what would you advise them? Right? How else could you think about it? There's always some other way that we could think about it that makes it better. Learn from other people. Who are the people who are just the rock stars in terms of coping? How do they think about it? What do they do? What do they tell themselves? You know? How is it that Sarah is able to get up there and go and talk to the Congress people? What does she tell herself? How does she do that? How does she prepare? Who do you know who copes well? Talk to them, interview them, make them part of your circle of advisors. Learn from them. How do they think about themselves? How do they think about their challenges? Think about the challenges that you have overcome in your life. What did you tell yourself about those? How can you use that way of thinking to overcome these challenges? What would you do differently if you modeled yourself on someone that you admired? With kids, this is the what would Batman do trick. I kind of like the what would Wonder Woman do trick. You know, I like that lasso of truth. You know, think about someone that you admire and think about being the person that you admire and think about how you want to look back in a couple of years. And notice what works. When you feel good, who are you with? You know, there are people who bring you up, there are people who bring you down. Start paying attention to that. What are you doing when you feel better? Where are you? I have friends who are gardeners. Any gardeners here? Right. How do you feel when you're gardening? Right? Now, me, I kill plants. Black thumbs. Totally black thumbs. On the other hand, music, I love music. Lifts my mood, you know, gives me energy. What are you doing? Who are you with? What are you focusing on? What are you thinking? Start to notice, because our brain, for whatever reason, probably because it enhanced our survival, right? Our brain defaults to the negative. Have you ever noticed that? Right? You come home, what do you tend to talk about? What went wrong in the day? Right? That may be good for survival and good for problem solving. It's not very good for supporting our mood. And there's all this research. What I'm talking about here, these tools come from cognitive behavioral therapy, which has one of the strongest evidence base in terms of effectiveness, right? From mindfulness, from research on positive psychology, research on quality of life and increasing happiness and joy and satisfaction. So notice patterns and start to do more of what works. Now this is my next to last slide. I want you to think about any negative emotion, any irritating or difficult or distressing situation that you've got right now. I want you to think about which of the techniques I've talked about today that you'd be interested in using. You might just take for a trial run. Might just experiment with. Whether it be thinking about 3 ways something could be better, and then 3 ways it could be worse. Or asking yourself, is this helpful? Is this really true? How could I think about it differently? What would somebody else say? Or thinking, what would I advise someone if they came to me? What advice would I give? We tap into our inner wisdom for somebody else. We sometimes forget to do that for ourselves. So any of these techniques, think about what you're going to do, and then write down when you're going to do it, what exactly you're going to do. What are you going to say to yourself? What actions are you going to take? What are you going to say to somebody else? You know, maybe you're going to practice next time before you go in to see the doctor some of the ideas that Dr. Bartholomew laid out. Maybe you're going to start to look into some mindfulness or some yoga. Think about what you're going to do, and then tell somebody who's going to be supportive. They did a study on New Year's resolutions, right? They found that if you just made the resolution in your head, you had about a 1 in 5 chance, about a 20% chance of actually carrying that out. It'd be gone within a month, pretty much. If you wrote it down, just that, wrote it down, you just about doubled your chances of carrying it out. But if you wrote it down and you told somebody who was going to be supportive, you then tipped the scales and had a 60% chance of actually carrying that out. So find who's going to support you in the healthiest actions that you can take. And get those people in your life and hold them close to your heart. And write down what you're going to do. And email me if you have any questions. Thank you so much for being here, for your time, your attention.